Hi, it's Caitlin from Caitlin J Osteopathy. I'm just going to go through some exercises with you today that will help with your hip pain. We're going to come to lie on our backs to do some lower back mobility in that position. So gently lie down on your back, hands down by your side, your knees are lifted gently up towards the ceiling. We want to walk our heels out a little bit wider, so about the width of the mat or just wider than your hips. Bring those hands out into a capital T position, so out to your sides. Going to rock our knees across to the right, allowing that left hip to lift if needed. Bring your gaze to the opposite direction. Then going to float our knees back through center. Rock those knees across to the other side. Take out my plant. Bring your gaze away from the knees. Floating back through center with an inhale and exhaling as you bring your knees across and your gaze is coming to the opposite direction. We want to keep our shoulders nice and steady on the floor here. And you may feel that little stretch in through the front of your hips also. Making sure you don't just let those knees fall towards the floor. We want to control the movement in both directions. And keep focusing on your breath. Continuing to do that until you feel that range through your hips increase. And you feel any restriction through your lower back decrease. We're going to go through some foam rolling and spiky balling that you can do for your hip. So the first one we're going to do is our adductors. So what we need to do is come to lie flat on your belly, but place that foam roller on the inside of your thigh. You want to bend your knee up to about 90 degrees and then make sure your shoulders are square down towards the floor. Then I'm going to gently start rocking and rolling that foam roller up the inner aspect of our thigh. Rolling forwards and backwards. And you can hover on some really sore spots and do a small little roll backwards and forwards until that tender spot relieves. Or you can just keep rolling back and forward along the length of that muscle. If you do find a really tender spot, the other option is to straighten the leg and bend and straighten and bend. So we're going to foam roll for about a minute on each muscle. We're going to roll out through our quads. So we're going to place the foam roller along the mat. Come forwards onto your forearms or onto your wrists and gently place that foam roller along the front of your leg. You're going to lift up through your feet and start gently rolling back and forth. All the way along the belly of that quad. So down to your knee and all the way up to your hip. You can do both legs at once. If you want to focus on the outside of your quad, you can turn slightly across to the side and focus more on that outer aspect of your quad. Again, you can hover on any sore spots, allowing that muscle to sink down into the foam roller, or you can gently roll over that spot until that tension relieves or you feel that knot vanish, and then start rolling through the whole muscle again. You can roll on the outside of your opposite quad, coming back and forth. If it's too much trying to do a single leg at a time to get that outer aspect, just stay rolling on both legs rolling back and forward. You can also roll out through your hamstrings, so through the back of your legs. So you want to place that foam roller just above your knees onto those legs. Place your hands down by your side and then hover your bottom off the floor. I'm going to roll forwards and backwards along the back of that leg. It can be quite strong through your shoulders as well because you've got to support your body. So if it gets too much, just take a rest at any stage. And you're rolling back and forwards through those hamstrings. Then you want to roll on for about a minute or until you feel that tension relieve. You can hover on some tighter spots and roll through those legs, or gently roll through the foam roller to decrease that tension. Next, we're going to grab our spiky ball or tennis ball or whatever sort of ball you have at home. And we're going to do a little bit of work in through the front of that hip into your TFL. So we're going to grab that spiky ball, place it on the mat, shift our weight over that ball. So your TFL is that muscle that almost plays tug of war with your glutes in through that hip joint. So we want to hover on that TFL and gently roll side to side, just in through the front of that hip. And again, if you find any sore spots, you're just going to hover on them and gently release the weight through your hands and through your leg to sink more of your weight in through that spiky ball and relieve that tension. And then we're going to move on to that next little spot. You can also do that against the wall if you would prefer, if it was too much trying to do it on the mat. We're going to do some spiky ball work through our glutes. You can also use a foam roller if you have one, or just a tennis ball without the spikes will also do the same job. So I'm going to place that spiky ball onto the mat. And then we're going to gently lift up through our hips and place that glute onto your spiky ball. It can be pretty tender, so you may need to use those legs and your hand to lift yourself off the ball. Then we're going to start rolling around through those glutes. And when you find a nice tender spot, we're going to sink into that spot, allowing that glute to relax and take a few breaths. And allow that glute to sink a little deeper into that spiky ball on that tender spot until we start to feel that tension relieve. Or if it gets too much, we're going to move onto a different spot, working through that glute and finding some different spots to hold onto. And we want to do that on both sides. If you prefer to use a foam roller, you can bring that foam roller, come to have a seat on your foam roller, cross your leg over so you're in that figure 4 position, and then we're going to roll that glute over the foam roller, rolling forwards and backwards, that entire length of your glute in through the back of that hip. Again, similar to the spiky ball, you can find those extra little sore spots and just try and hover over them or do a slight little roll back and forth over those little tender spots. We want to foam roll for about a minute on each side. The last little thing we're going to do for our hips is we're going to lie down on our back, hands down by our side. Keep that left leg bent up for support, that left foot steady on the mat. We're going to lift our right leg up and straighten it up towards the ceiling. We're going to gently lower that leg down and lift it back up. Lowering down and lift it up, controlling the movement in both directions. Feeling that relieve tension and encourage that movement through your hip joint. If you're feeling okay with that movement, you can start adding on with a little circle, circling out towards the side, back through centre and out. You can do big circles or you can just do little circles, whatever you're comfortable with and whatever feels okay on your hip. You want to aim for about 5 circles in one direction. Then we're going to circle through the opposite direction and back through centre. If it's too much with the circles, just keep working through that up and down movement. And we're aiming for 5 circles in that direction also. Place that right leg down onto the mat. Lift your left leg up and straighten that leg long to the ceiling. Lower the leg down and back up. Doing the same thing on that opposite leg, controlling the movement in both directions. Lifting up and lowering. If you're feeling okay through that hip, we're going to start adding on with some little circles. Opening out through that hip, encouraging that nice little rotation through your hip joint. You can circle little circles or big circles. And then we're going to circle in the opposite direction. Relieving tension through that hip and encouraging that rotation. You can do big circles or little circles and aiming for about 5 in that direction also.